Hello, Gila River, and welcome to another COVID-19 vaccine update and discussion forum. I'm Roberto A. Jackson with the Communications and Public Affairs Office. Thank you for logging on today. I will be joined by Candelaria Preston from the Tribal Health Department and Dr. Anthony Santiago, CEO of Gila River Healthcare. Today is MLK Day, and we want to acknowledge Dr. King and the civil rights movement in the US. And I bring this up because it's an important day. But also, if you look at the data, the same people that Dr. King advocated for, African Americans, Hispanic, Latino, and Native Americans, have been disproportionately impacted by COVID at a higher rate than other groups. In fact, Native American life expectancies are considerably lower than the average as well. So take this opportunity to look up Dr. King or the overall position of Native American, Alaska Natives, Native Hawaiians in healthcare studies, and let us know what you find. So welcome once again. We want to acknowledge our audience today across all the platforms. And if you will, please join us in a moment of reflection and respect. And we're going to take a brief moment of silence because we want to just acknowledge the tragic loss of lives to COVID-19 and our deepest sympathies that go out to their families and friends. We also commend the heroic actions and courage of healthcare professionals, public safety, volunteers, and those still working in the public fields. So please, if you can, join me in a moment of silence.
Instagram at Dr. Day Action. Well, turning now to Wednesday's presidential inauguration amid serious security concerns. Washington on lockdown for most part. President-elect Joe Biden prepared to take the oath of office.
A moment of silence to acknowledge the people that have passed away from COVID-19, the family, the friends, and those still suffering. So we're embarking upon, I think, our third forum in the last week or so. So the purpose of the forum, it's part of Governor's COVID-19 Task Force and the JIC, which is the Joint Information Center, which partners with GRBC, CPAO, Gila River Healthcare, GRPD, and FIRE. So this is a good chance for us to share information, get educated, because as you know, we're at a very critical and very important time when it comes to the vaccine and testing. And it just goes without saying that the more of these forums we can have and the more that take place, the better informed we are as a community. So we just want to begin by letting you guys know that some of the things we're going to be talking about today are going to be about the vaccine, are going to be about testing. And we want to get some of the most pertinent information right now from Ms. Candy Preston. Is Candy on the line? Maybe we can have Dr. Santiago jump in right about now. Doctor, are you with us? Okay, everybody, we're going to keep moving along. Let me just go through some of the topics that we're going to be talking about today while we wait for Dr. Santiago and Ms. Preston. So we're going to go through some of the latest information on the cases in the community, and then we're going to be going through the topics of community testing, the testing locations, and also the vaccine. What is the vaccine? What is the makeup of the vaccine? The vaccine, it was approved in a very unique way, and we'd like to talk about that as well. And there's a lot of information about the trial data, safety, side effects, demographics, and then the real life vaccine stats, because I think we're at that point now when we can look to some of that information and apply it to what's going on here today. And so we have some videos too regarding some experiences of people you may know who have received the vaccine. I'm talking about Governor Stephen R. Lewis, Lieutenant Governor Monica Antone, and there's also an additional video that talks about vaccines too, provided by Gila River Healthcare. So we're going to be very delighted to show those because these are very important videos. And then the rollout plan. You guys have probably heard about the different phases that we're in as a community, along with Gila River Healthcare, and how these decisions are getting made. So this is going to be very critical stuff, and I want you guys to pay attention to that. And then we want to know, when are we going to get our vaccine? You know, do we qualify? Do we fall under certain phases? Do we have certain health conditions? Are there any other kind of restrictions? So that's going to be something that we talked about in the previous ones, and then definitely that's going to be a big subject this time around. And we're back. Okay, thank you very much for helping us while we walk through those technical difficulties. You know, Zoom and networks and connections and things, they could really play into how we deliver these forums. But as you know, the troubleshooting, it got resolved quickly from what I can tell. So this is a good opportunity to acknowledge Gila River Broadcasting Corporation, who has been steadfast in leading, you know, this technological wave that we can come together on these types of platforms. And so this forum will be broadcasted live throughout the Gila River Indian community on channels 19.1 and 29.1. And so we want to thank everyone for logging on Zoom and then also watching us on our other platforms. And so while I'm looking across our call list right now, I want to bring up some of our guests that you may be familiar with previously. Dr. Santiago, I think we're still waiting on Candy, but if you're raring to go, let's just start this forum if you don't mind. So you're up to date with all the data, with some of the studies and the research. So anything that you want to touch on from the get-go? Okay, so we're still waiting on Santiago, so give us a moment. Thank you. slightly different story, but we know that I talked to him just a few minutes ago, and so he's getting those issues resolved. And so I mentioned some videos earlier, some vaccination accounts and narratives regarding our leadership. So Governor Stephen Roe Lewis and Lieutenant Governor Monica Antone, they received their first dose, I want to say about a week and a half ago, at the Viola Johnson building in Sacktown, Hugum Memorial Hospital location.
Okay.
And so,
Roberto, can you hear me now?
oh, doctor, is that you?
It is, sir. It looks as if I had to call in twice. I apologize.
Okay, doc, we'll give you a free pass. How does that sound?
Sounds great.
Okay, so we just kind of kicked off the forum as usual. You were probably on hand for a moment of silence, and just the serious nature of these consequences. How Native Americans, the community, have been affected disproportionately from COVID-19. So, I think that was an appropriate way to open the program. And for all of our viewers out there, some of our fluent speakers, Autumn, Peeposh, perhaps, maybe we can bring you on toward the end of our program, and we could have a prayer as we close today's proceedings. If there's anyone available.
Well, Roberto.
Yes.
Oh, I'm sorry, I couldn't hear you. You're asking for a volunteer?
Yeah. At the end of the show, we're going to try to get someone on so they can give us a prayer while we close things out. So if you are in the chat, or if you want to just comment, maybe we can bring you on later if you care to volunteer. So moving along, Dr. Santiago, how do you want to maybe let us know where we're at? This is January 18th, 2021. What's some of the most pressing things we need to know about the virus right now?
Well, again, good afternoon to everyone, and thanks for being patient. I think I want to go on the theme of your introduction first and just talk a little bit about the legacy of Martin Luther King and dealing with and advocating for disparity. In Arizona through January 17th, yesterday, the data shows that when you take a look just in the state of Arizona, the cases per 100,000 people, if you're Caucasian, are about 5,600. But if you're an American Indian, it's over 11,000 per 100, seeing that, again, twice as likely to have contracted COVID-19. And unfortunately, when it comes to deaths, it's actually 3 times as likely. And we've seen that all over the country for other minorities, African Americans and Hispanics. And as you know, Roberto, perhaps you may wish to share this as well. As we move forward and talk about today in the vaccines, it is so important that we're focused on educating and answering people's questions, because we know there's a lot of concern and hesitancy out there, perhaps just about the vaccines and the science, but perhaps even just mistrust. And I think especially on a day like today with Martin Luther King, we have to recognize that right now the state of Arizona is the epicenter again in the country. Arizona has the most number of new daily cases per resident, as well as deaths in the country. And when Native Americans are just over 4% of the state's population, but they're over 9% of the deaths, over 12% of the hospitalizations, we again realize that when it comes to recognizing Martin Luther King, we recognize as well that one of the most important things is to make sure that we're advocating for getting Native Americans the best healthcare possible. We do that a lot at Gila River Healthcare, and one of those is the opportunity to be vaccinated. So as much as the surge has often been a topic for us during our sessions, today we're really going to focus on vaccines.
Thank you very much, Doc, for kind of setting the table for us today. And usually Ms. Preston shares with us some of the case information, the community cases, COVID-19. And I have some of these stats, Doc, if you want to maybe jump in as needed. But so far, the community has conducted this is as of January 18th, we've conducted 162,624 total tests. And let's see here, the positive cases in the community in that time have been 2,209, and that's just for GRIC. And then the total positive cases have been 5,464 detected. And that's for community members has been 44, which is a positive rate of 4.1. And just moving across to the state line, Arizona cases, there's been confirmed cases of 679,282, 11,265, and a positive rate of 13.8. Doc, I think that death rate for the state has increased dramatically since the last time we talked. Anything else in those numbers that jump out at you?
Yeah, I think maybe just rather than the individual numbers, just to give a context to the group of why we're so focused right now on the surging cases. You know, we right now, when you take a look at what's happened worldwide, it's been 384 days since the first case. In the United States, 363 days. And here in Arizona, 315 days since the first case was detected. For Gila River Healthcare, in terms of us identifying our first case, it was March 16th last year. And it took us all the way to November 29th to find just about 50% of our cases. But when you start thinking from December 1st on, it's been almost the other 50%. And when you talk about after Christmas, since about December 29th on, over 25% of all of our cases. For GRIC community members, nearly a third. So when you're talking about just over 3 weeks, accounting for over a quarter of all cases after we've been going through this almost a year, I think that statistic perhaps is most meaningful. And for us at Gila River Healthcare, when you talk about testing and also for the community, it's been a major focus to be able to test. Because as everyone knows, unfortunately, this virus is more often transmitted when someone doesn't have symptoms. In fact, a recent study at the CDC that was just published showed that 59% of infections in this country happened when either the person had yet to develop symptoms or, in fact, they never developed symptoms. And that's the purpose of testing. We certainly test people when they come to the hospital and they're sick and don't feel well. But we also do a lot of testing when somebody shows up and gets tested when they feel well, because we can then identify that they're a carrier and we can have them quarantine and try to stop the spread. And we've seen again here in Arizona, when in the summer, we were the place in the country with the most cases per resident. We are again right now. And so I think regardless of what Candy and I can talk about individual numbers or what's happening in a particular district, the key is this. It is spreading, it's spreading rapidly throughout the state. There are concerns that even newer versions or variants of the virus, which are even more contagious, are out there. Now is a very important time for people to not be fatigued, to follow the guidelines, to not engage in any unessential travel, to distance, to wash their hands, to wear masks, and what we're going to talk about today, get vaccinated.
You know what, Doc, you mentioned the testing and the testing program for the community through, Governor's Task Force, Gila River Healthcare, of course, and then the Community Tribal Health Department. It's been a pretty robust testing plan, and we know that it's been about a week since the information on the testing location has been changed. So we know that it was going from district to district throughout each week. And so the decision was made to consolidate them at Huaga Memorial Hospital and also the Comac Health Center. So we do know the testing is available at both places. You want to break down these locations and maybe the change and kind of how did all that come about, and what can you guys tell early on after you made this decision?
Well, it's a great question. You know, anytime there's a change, it's important that people are aware of it. And as you can see on the flyer, if you're online right now, it shows that from 9 a.m. to 9 p.m. right here at HooHoo and there's excellent signage when you come on campus to get you to what we call the wash rack area. We're doing testing, right? Drive-up testing. In fact, from Tuesday, January 12th through Saturday, this past weekend, just those number of days, we had over 1,037 tests performed across our enterprise on how we tested HooHoo and at KHC. And at KHC, again, it's on campus there on the west side. It's Monday through Friday from 8 to about 3:30. And the importance of testing can't be overstated. Now, we were at one time on a rotational basis going out from district to district. But, you know, to be honest, the numbers really started to come down. In fact, the last time we were in District 3, we did a total of 164 tests in the 3 days that we were there. You can see in just a handful of days since we've moved it onto our campus, our numbers are considerably higher. Now, that does include some individuals who may have been previously tested during the day at our emergency department, where we'll actually have you, if you don't have symptoms, come to the same site where we're testing everyone else. But you should also know that from 9 p.m. to 9 a.m., you can actually be tested at the ED as well through the drive-through. So literally 24/7 testing is available at HooHoo. You know, as I said, Roberto, a lot of increasing cases. That also means a lot more people who are infected who need our services. For example, just this past week, from the 10th on a Sunday to the 16th a Saturday, in 1 week, we had 2,782 calls to our COVID hotline, people needing help. We've had more people that are at home that need to be monitored. And our inpatient census, our own admissions to our own hospital system, are at the highest that we've ever had in our organization's history, as well as now during COVID. In fact, even as of this morning, 18 patients admitted in our hospital system, 15 of them with COVID. And again, every day we're looking at statistics, 55, 65, 70 patients that are in outside hospitals as well that are community members, with nearly half of them with COVID. So when we have to make decisions about such as bringing testing onto campus or how we have to manage so many different demands, it's often because to use our staff the best way, but often it's also about how can we get the best care to people. And right now, by bringing our testing on site to 7 days a week on HooHoo, even 24 hours a day, and again, that one spot for 12 straight hours outside the ED as well, we've seen the testing numbers go up considerably. So I think it's actually easier for people, and it allows us to use a smaller number of staff to do more work.
That's a great point. That's a great point, Dr. Santiago, and I'm glad that the testing is getting ramped up, as you said. So we want to thank everyone. It looks like we got about 33 participants on the Zoom call right now. I'm pretty sure we have a few logging or watching live on Facebook. Gila River Broadcasting is sharing the live portion on social media as well. So if you guys remember the last time around, or if this is your first experience with us, we have a chat feature on the Zoom call. So as the questions start to kind of pop into your brains and you're just wondering like, man, I didn't, maybe I could get some information on, you know, certain topic, go ahead and just type in the message right there and Dr. Santiago will see it. And if he doesn't get to it, maybe throughout the portion of his discourse, we'll save it for the very end and we'll compile all the information and all the questions and try to answer them either one by one, or if Dr. Santiago sees something out of the corner of his eye, then he can certainly address it at that time. Same thing with our Facebook comments too. We had some wonderful comments through our Facebook section of the broadcast. And so same goes for you watching on your social media device platform. So go ahead and fire away with the questions and we can get those organized as soon as possible. Dr. Santiago, so the plan to do all of the testing, we know it's been underway for a couple weeks. I think you guys first started doing your test in late December. And so you know that Governor Stephen Roe Lewis and Lieutenant Governor Monica Antone, they've been, you know, at the vanguard of advocating for tests and stuff. So I know you're aware that they received their tests. We have a video that we're going to show of their testing experience. It took place about a week and a half ago. So we're going to get that dialed up here very soon. And we want you guys to see from our leadership's perspective what it was like for them to get tested. And we're going to go ahead and we're going to get that started here very soon. So the interesting thing about Lieutenant Governor and Governor Stephen Roe Lewis's testing experience is because, you know, we all have our own medical history, medical background. And so you get to, especially with Lieutenant Governor Monica Antone, she's really forthright with some of that information as an elder, someone who is familiar with diabetes, as a cancer survivor. So I think that perspective is much needed too, because we know that there's a lot of questions about those with a medical history, medical background, and you know how that plays into your decision or not to get a test. And so we can see Lieutenant Governor Monica Antone as she gets that information and as she shares it too. Same thing with Governor Stephen Roe Lewis as well. We get to see his test. So we're going to get that video up here shortly. And if you're just joining us, I'm Roberto A. Jackson, and this is the discussion forum for COVID-19. And we just heard from Dr. Santiago. So if we got that video ready, we are going to dial it up. So you guys sit back, watch this. It's a few minutes long. You may have seen it already, but let's get caught up with what took place with Governor Stephen Roe Lewis and Lieutenant Governor Monica Antone during their testing.
This vaccine is an important milestone for our community as we keep our community safe moving forward during this pandemic. Well, this is a very exciting and important time for the community. We have our first batch of doses of the vaccine, and so we're beginning to roll out our vaccine plan. And I think it's important for the community to know that the vaccine is safe, that we are in coordination with Gila River Healthcare, with our public health professionals, and also with our state and our federal partners as well, making sure that the vaccine is carried out in a very safe fashion. And I think it's important to show you firsthand that they're safe. And that as your governor, you know, I'm modeling this good practice and showing you that the vaccine is safe as well. Right now, you know, it felt like just a normal shot. I'm not experiencing any type of reactions at this point. A little sore, but that's, you know, I think that's normal if we're taking a shot. I was excited to take it. And you know, I think this is really an important milestone for our community in our fight to keep our community safe during this pandemic.
My name is Monica Antone, current Lieutenant Governor, and the reason I came in today, and you know, this pandemic has taken a huge stride on our people, our nation. And one of the big factors for me to take this shot is because I'm high risk, I'm a diabetic, I'm also a cancer survivor, and also my age. Being a mother and a grandmother, I feel that with this pandemic going on and how it's taken so many of our loved ones so fast, that this vaccine is here for us today to help us to fight this COVID-19. You know, just down the line, I just feel that, you know, for myself, for safety, for protection, just to make sure that I stay within the guidelines, I feel it's important to mask up, important to wash your hands, and whatever we can do to keep this vaccination, if it's here for us, which I know this is my first dose, and in about 3 weeks I have to come back for a second one. I'll be sure to monitor make sure that, whatever reactions come about, that I will be able to record that for myself. And, again, as a mother and a grandmother, and, the compassion I have, not just for women, but for the men, the elders, the youth, and whoever, is applicable to take this vaccine. I'm here today because I feel that it's very important as a leader to come forward and share with you that it's very important that we take this vaccine and be able to fight what we're fighting during this pandemic. So if you get a moment, a chance, read up on it. If there's a website on there, the EEOC.org, read up on what that vaccine instills. Read up on the after effects. So thank you, God bless you, and you take care, mask up, and be safe.
Thank you very much, DRBC, for showing that video. And we want to thank Mr. Kyle Knox from the Gila River Indian News, who conducted that interview, who got that footage, who edited and put that together. So fine work by that young man. And so Dr. Santiago, that looks like a pretty straightforward account of what it's like to get the vaccine. And so just some little background information on the vaccine. So I know you've kind of studied this a bunch of different ways, and there's significant research that you've read up on. So, I mean, just the ABCs on what is this vaccine and what is the makeup of this particular shot that we're going to be getting.
Well, I appreciate the question. And again, always great to see people getting their vaccines. And also, again, reminding everyone how important it is to wear our mask when we're speaking to others. We don't need to pull our masks down to talk. With the vaccines in general, I know what's unique about the current two that are approved for emergency use, the Pfizer and the Moderna. A lot of people have asked, what's unique about these vaccines and what should I know about it? So each of them, even though they're two different companies, are very similar. The first thing they contain is an active ingredient. And that active ingredient is a little piece of material that codes for or is the recipe for the spike protein on the virus. And all of us have seen pictures of it, where you've seen a picture of the virus with all of those spikes sticking off of it. Those spikes are so important because that's how the virus attaches to a receptor in your airway to gain entry into the body, much like a key turning into a lock. And what the vaccine does is it contains a small piece of the message for making up a small piece of that spike protein, just enough for your body, if it's exposed to it in a vaccine, that your body can make that tiny little piece of that protein, not the whole virus. You're never going to get COVID-19 from being vaccinated. It's not going to have the whole virus in it, but it'll have a little piece so that you'll make just enough of it so that your body can then recognize it and mount a defense. And that defense is creating antibodies, something that if you're ever infected with the virus later, you'll be able to recognize it and fight it off. And this is very common. We've all had polio vaccines, measles, mumps, rubella, influenza vaccines. So again, there's a part of the vaccine, which is that active part that generates that immune or defense response. But also in it are salts, which are in part of every solution to buffer what they call the pH, the acid and the base. There's some simple sugar in it, which is used because these vaccines, in order to keep that active part of it stable and have shelf life, so it can actually be made someplace and shipped to us and then used, they have to be stored at very, very cold temperatures. When you have a little bit of sugar in a solution, it actually allows something to be frozen in a safe way and then be thawed and still be active. And then there's some fatty molecules, these little fatty molecules that are surrounding that active message, that little piece of the vaccine message, so that when you inject it into an arm and before it can get into a cell, it protects it from your body's defenses breaking it down too early so that you can have that immune response. And those are the active ingredients and the solution, Roberto. However, one thing that's in that is a small chemical. It's a long name, but I'm going to share it because you may be reading about it. And it's called polyethylene glycol, or PEG, P-E-G. It's almost like a detergent. And it coats those little molecules around the active part of the vaccine, that little piece of message that codes for that little spike protein. And it encircles it to give it further protection. We've learned that most likely, and the research is ongoing, that this may be why some people have had an allergic reaction to it. And there's a lot of ways to talk about this, and I think now's a good time because I know it's in the news. You know, since the government, the CDC, has been tracking vaccines as of the 15th, and because today's a holiday, they haven't updated their website, but we've seen about 12.3 million doses administered. When it comes to severe allergic reactions, it's just about 30 or so. However, there's some other data out there, and I want to talk about it briefly because the average vaccine, about 1 in every 772,000 people might have a severe allergic reaction. That's a very, very low number. With this vaccine through January 15th in this country, it's about 1 in every 423,000 people. Still very low, but enough that it gives us concern. There are a couple things that have come out in the news, and I think one of them might be in the chat today. When you actually do track the actual data, what they call the Vaccine Adverse Event Reporting System, or VAERS, that's where everyone who gives a vaccine is mandated to report what might be happening to people who have received the vaccine. A couple things have happened, and so the system is working. First, there are people that they're concerned that have passed after receiving the vaccine. Now, whether this is related to the side effects and they had a pre-existing condition or otherwise, that is still being investigated. So every time something is reported doesn't mean that they've made a conclusion, but it's important that people are reporting anything that needs to be investigated. Also, just in the last day or two, people may have seen that in the state of California, there was a concern with one of the vaccines called Moderna, and they received a particular lot. The lot number actually is 41L20A. And they received it in California the 5th through the 12th. And they showed at one community clinic in San Diego that used that one lot that there were more people that had allergic reactions than would be expected. And so they literally gave those roughly 10 people or so the medical attention they needed. But the California Department of Health recommended that any vaccine from that lot be held and not administered. It's actually 330,000 doses to 287 providers in the state of California. The CDC and FDA are going to investigate that lot, but it's important to note that in all the other places that received that lot, there haven't been any real reported concerns. It's all related also to just one clinic. You should also know that at GRHC, we did not receive any doses that were from that lot. We have had 2 distributions of the Moderna doses, and we have very different lot numbers. We are not a part of that at all. And I just want to remind everyone that, again, when you hear these things, that's good news because it means people are doing their job, they're investigating it, they're letting the public know. But right now, overall, based on the sheer number of vaccines out there, we certainly expect some people to have some sensitivities after they receive it, and we'll talk about it. So far, the severe allergic reactions are low, but we are tracking all data that comes in, and I know many of you might be as well. So I'm actually very glad to hear that people are reporting through it. Things will be investigated. I'm very glad that California tracked down the single lot there in California that might have a problem. Again, we need to see the results. But everyone should know that we do not have that lot here at GRHC, and we will not be giving any vaccines from that lot. So again, just want to make sure people are aware of the facts as they are up to date.
Thanks for clearing that up, Dr. Santiago, because that is the type of stuff that we are being very vigilant of in the community when it comes to our own vaccines that are getting administered to, as you know, the elder population, 55 and up, irrespective of health conditions. The vaccine is open to them too, as we are in this phase 1B, as we call it. So, Doc, let's get into the, I know you touched on some of the safety side effects. I know you received the test, and so maybe firsthand and just some of the research. What's the most common thing that occurs when someone gets the vaccine?
Well, you know, I have received it. I know many of you have. I hope many more of you do. You know, when you get a vaccine, it's no surprise that for most people, they're going to notice that they've had a shot in the arm. And probably within 3-4 hours after, they may notice that their arm's a little sore. Maybe by 12 hours later, it kind of peaks to that sense of soreness. And we've all had a tetanus shot probably in our life, and we know how that feels. For myself, my arm hurt for about a day and a half or so after the vaccine. It wasn't severe. That is still probably the most common side effect, although not everyone has it. I'd say around 75, 80% of people report it. The other is headache. People definitely get from a mild to a moderate headache that usually lasts. Comes on usually again a number of hours after the vaccine. It may last that night, and most people go to bed, wake up the next day, and don't have the headache. And some people may feel tired or a little fatigued. I felt that. I actually went to bed earlier that night than I normally do after the day I received the vaccine. But those are the three most common things: a sore arm, a headache that's mild for most people, and feeling a little tired. Others, in their much lower numbers, maybe some fever or some chills, some muscle aches. And again, when we take a look at the actual clinical trial data, right? And when we talk about that, we're referring to Pfizer and Moderna, the two current emergency use authorized vaccines. And they reported, of course, on all the data that we received to be able to review, certainly went to the FDA before approval. They'll talk to you about what's in the vaccine, who was in the trial, breaking it down by how many people, their ethnicity, their gender, if they had other health conditions. They broke down what they were measuring and how effective it was and how they did that. What were the most common side effects, which we're talking about. And again, when we talk about that right now, fortunately, what we've seen after starting to vaccinate, and here at Gila River Healthcare, again, through Sunday, yesterday, we've done about 1,400 vaccinations so far. And that doesn't include things like the Caring House and others, which are additional vaccines. We've only had a couple of our employees that needed to call out the next day because they didn't still feel well. About 1.5% of people, I would say that, you know, their symptoms were moderate or more significant than others. But in general, I would say overwhelmingly, it matches the clinical trial data, that local pain, some fatigue, and some headache. And in the trial, overwhelmingly, you know, 75, 85% of people had some mild pain in their arm. About half of people commented on feeling fatigued, and about 35 to 50% of people said they had a mild headache. Other than that, the numbers go down pretty significantly in the trials, and it's the same of what our experience is when we talk to the patients who have already had vaccines or our own employees.
So, Doc, we appreciate that information, and And we know that, your experience and how it aligns with some of the other research. So thanks for clarifying that. And once again, welcome everyone to our forum today. It is being broadcast on Gila River Broadcasting Corporation channels 19.1 and 29.1. And, we're over here on Zoom meeting as well. And over on Facebook, they are airing this live on top of that. So, Doc, it looks like our chat is gone dark this time around. Usually it was very active, and we do have a few questions on Facebook that we're going to get into. But again, if you guys have a question, please address it in the chat to Dr. Santiago. And this is a good way for us to hear your question and answer it during the live session. So let's try to get those questions coming in as quickly as possible. What do you say, Doc?
Yeah, absolutely. We're happy to hear questions, but let's, we have a little bit of our own agenda here we want to get through. So I'm going to spend a few moments here, Roberto, on the actual clinical trial, though, because I think it's important to understand it and to answer people's questions, because I know one of the questions I've been asked most often, I know you have on all of these chats, is, that vaccine seemed to come along pretty quickly. And, should I be concerned because it appears that they were able to bring that out for all of us within a year? And I think for some people that gives them pause. So I'd like to try to answer those two things. From a clinical trial perspective, it's hesitant about receiving the vaccine. One of the reasons might be is that they wonder, did they test it in people similar to me? And, the Pfizer trial had 44,000 participants, and the Moderna had 30,000. And in a trial like this, they basically divide people, half of them receiving the vaccine protocol and half of them not receiving the vaccine. And that way they can compare the two to decide whether or not the vaccine is helpful in preventing getting COVID-19. When it came to both trials, they were pretty similar. They were about half and half, men and women, about 51, 52% men, the rest women. The average age was about 52 to 53 years old, although they did have people in the Pfizer trial from about 16 and up, and in the Moderna trial, 18 and up. For those over 55 in the Pfizer trial, 43% of the people in the trial were over 55. And in the Moderna trial, in fact, a full 25% were even over 65. About 82% of people were white. The rest were people of color. For Native Americans, there were over 200 in the Pfizer trial, and about the same or so in the Moderna trial. Perhaps even more important is that it wasn't, again, just young, healthy people. There were many people that had kidney disease, liver disease, diabetes, lung disease, heart disease, even people whose immune systems were compromised and have HIV. And what the results showed is that regardless of your gender, regardless of your age, regardless of your ethnicity, and regardless of whether you were young and healthy or you had one of these other pre-existing conditions, that essentially across all groups, the results were very similar. And for Pfizer and Moderna, it's roughly 94 to 95% effective in preventing you from contracting COVID-19 during the clinical trial. How do you interpret a number like 95%? What does that mean? What they did was, again, half the people received the vaccine and half didn't. And then they literally wait until they got to a high enough number of people who contracted COVID-19 that they could then statistically compare between the group that did and didn't get the vaccine and how many got it in each group. And for Pfizer, essentially it showed that in people who got the 2-dose protocol, and then they followed them out afterwards, that if you received the vaccine, you were 95% less likely to contract it, because they identified 170 people who contracted COVID-19 in a short amount of time. And 162 of those 170 were in the group that did not receive the vaccine. Only 8 in those that received the vaccine. And more importantly, even when we talk about the Moderna trial, which was very similar in numbers, we saw that almost every single severe case of COVID-19, the person who needed to go to the hospital, that needed to be in an ICU, that essentially 100% of those severe cases were in the people who did not receive the vaccine. And so that's how they get to a number that is showing its effectiveness, how effective it is in during the clinical trial and afterwards preventing people from contracting the illness. And we've seen it again, equal across all groups that were enrolled, and it wasn't just young, healthy people. We've seen some of the side effects. I think there are 2 things about it, though, that we have to answer. One is, if you receive the vaccine, you must complete both doses to have that level of protection. Number 2, that even though you will receive a vaccine and finish both doses, you can still carry the virus and possibly give it to someone else. You may not develop an infection yourself, but you can still transmit it. And so that's why everyone has to continue to follow the safe guidelines and wear their masks, no matter who they are afterwards. And, Roberto, at the last chats, as you talked about, there were a lot of questions. And I took some notes, and I have a few with me. For example, people wanted to know, you've said that it's safe, you've said that it's effective, you know that everyone's tracking that information, you have real-world people you can now look at, but they had a few questions. One is, well, how long is it going to last? And the fact is that while we continue to watch the people who have received the vaccine, certainly the people in the clinical trial are being followed. And just on January 17th, they published that at roughly 4 months out from receiving the vaccine, they take a look at the blood samples of people who did, and they show very high levels of antibodies, and especially what's important, strong neutralizing antibodies to fight off the virus. And that we're so far at 4 months. They're going to continue to track people over 2 years. There's a lot of belief that these vaccines will be effective for at least a year. We're waiting for that data. Again, that's based on other research. A lot of people say, well, I've already had COVID-19, so I don't need to get the vaccine because I was told that you develop antibodies. Antibodies is that general word that we talk about our body's ability to mount a defense against something. They really are. Think of them as swarming bees, but they only attack one kind of nest. They only get into one kind of nest, like, honeybees have theirs and wasps have theirs, hornets have theirs. So these antibodies can be very specific against this particular part of this virus. And that's what a vaccine does. It really creates what they call a monoclonal antibody, one type that's very specific. When you get an infection, your body naturally creates antibodies. Imagine how large that virus might be microscopically and all the places that it can be attacked, all those types of antibodies that can be created. Well, that's what happens when you get it naturally. And while you do develop antibodies, and all of us do, there's a lot of concern that a lot of the antibodies we create are not actually effective in fighting off the virus, and that they don't last very long. They may last 3 months or less. And we have seen people who had COVID-19 who recovered, who have become reinfected. So we know that people don't have enough natural immunity to be safe from this long term, that people who have had COVID-19 need to be vaccinated. And then the last comment, again, and get to your Q&As as well, Roberto, is somebody will say, well, that's really great. You've talked about what's in the vaccine. You've told us about the trials. You've told us a little bit about what's happened in the real world afterwards. You've talked about how long so far the research shows that it protects us, and people are hopeful it'll continue to be effective for at least a year, and we'll learn more here shortly. But geez, that's an awful lot to know in just 1 year. And, I'm concerned that it appears that this came out to the market so quickly. And so very briefly, I've touched on this many times for people. And it is complicated, but I think it's worth a moment or two on it. When we try to bring a drug to market in this country, it really does take typically at least 12 years. And it takes $2.6 billion. And for every 5,000 drugs that they believe might become an approved medication, only one out of those 5,000 are approved. We have a very laborious, very expensive, very bureaucratic process. And the fact is, every company competes with each other. It's very competitive. They're trying to make a profit. Certainly, governments don't work together. Companies don't share data. And the federal government practically never really invests in a particular treatment. But what happened here, because this pandemic is so lethal and so global in its reach, that a few things happened to make these vaccines come to market more quickly. First and foremost is a lot of investment. The federal government, it's estimated, has put at least $18 billion towards these vaccines in one way or another. Also, that these vaccines did not just happen in the last year. They've known an awful lot about these kinds of vaccines for about a decade, people working in it. There have been other coronaviruses, and one of them is called SARS. That's, a serious acute respiratory syndrome. And it's another coronavirus a few years back that crossed species and was very deadly. It also came out of, discovered in China. And the research on that has been ongoing for years to understand this kind of a virus and how to try to develop vaccines against it. Well, the same teams that were aware of that had a chance very quickly when this version of the virus, COVID-19, came out. There was a lot of preliminary work done, so they were well ahead of the game. There was a lot of money put in it. Countries worked together. Companies had to share their data. And unfortunately, because the virus is so contagious, the clinical trials, which often take the longest part of those 12 years, about 7 years to do the trials, the biggest challenge is actually recruiting people into trials and then waiting for the health condition to happen so you can see the difference between getting treatment and not being treated. Well, because of how deadly and how rapidly this virus transmits, so many people signed up for the trials quickly, and so many people contracted the virus who did not get the vaccine that they could do that statistical analysis so fast. And then lastly, the FDA and its approval process, again, these were not in-house scientists only. They convened some of the best people in the country at large academic centers who were not a part of the trials, don't work for the companies, have no financial interests, and they independently reviewed the trial data, which is how we were able to cut through so much bureaucratic red tape. And privately, as we talked about health disparities today with Martin Luther King Day, I'll just remind everyone that in a lot of ways, maybe what'll happen after COVID is we realize this is how we should be tackling healthcare problems. Imagine if this type of effort was put towards Alzheimer's or diabetes or cancer. So again, I know, Roberto, for some people, it creates apprehension. For the rest of us, we go, why isn't this the way we do other serious things? Because I actually think the fact that the vaccines came out so fast is a sign of what happens when the system works, not when it's broken.
You know what, that's interesting, Doc. And I didn't have a lot of knowledge about how these vaccines are developed and put to the market, but it's interesting to see that it's not done in a vacuum. And, there's just a lot of factors in the US when it comes to that, and then all over the world. So we are starting to get more questions through our chat, through our comments. And so we're going to get to those. We're going to spend the next last 15 minutes or so. Once again, my name is Roberto. This is the COVID-19 discussion forum and Q&A. I'm joined by Dr. Anthony Santiago, that's that kind of faceless New York accent that you hear chiming in information. And so he's been with us from the get-go, and I've been doing these with him. We've been doing it probably, I think, since March. And, I'm just like you. I got questions. I got a family. I got friends. I kind of want to know for my own peace of mind, and then also for others that might have questions, how can we understand this stuff at a basic level? And as the information comes out and the research develops, I want to thank Dr. Santiago, the Gila River Healthcare Board, our Health and Social Standing Committee, and then of course, our tribal leadership, our 17-member community council, Governor Stephen Rowe Lewis, Lieutenant Governor Monica Antone, and also former Lieutenant Governor Robert Stone before her. And then just how they were able to mobilize this plan and mobilize this effort. And we're going to get a good indication of how it's going once we get into more of these questions, because I know they are curious about that as well. So before we get into the questions, Doc, I'm going to let you get a sip of water because it's going to be coming at you pretty quickly, but we're going to show our final video. It's an instructional video of what to expect. And this is a good one, about the vaccine experience. So GRBC, go ahead and roll it.
I got vaccinated for my family, our organization, and our community. So please consider getting the vaccine to stop this pandemic, and that way we get back to our normal way of life. Thank you.
Okay, there you go. That's just a little snippet, and something to think about. What to expect if you do decide to get the vaccine. We just want to let everyone know that, and Dr. Santiago will correct me if I'm wrong, but there's no mandates to take the vaccine. But if you are in that category where you feel like it's something that you could do for your own health and wellness, and then that's kind of some of the things that you may experience along with Mr. Pablo from Gila River Healthcare. So. Dr. Santiago, we got some good questions. Are you ready to go? Let's start off with this question. It says, where are we at with the vaccines? That's kind of an interesting way to phrase that question. And maybe we could take it from the standpoint of the phases and the rollout plan. And we'll take it on to the next question shortly after that. What do you say?
Yes.
Yeah, sure. No, I think that's a great interpretation of the question. Where are we? I'm going to assume that it's probably where are we as a community in our rollout. And so again, as everyone knows, it was back in early to mid December 11th and December 18th that the vaccines were approved to be released. We started vaccinating on December 28th at Gila River Healthcare. Under the direction of Health and Social Standing Committee, we received federal guidance through the CDC as to who to prioritize, meaning that they were not going to have enough vaccines for everybody immediately in the country. They were going to have to give them out as they built up their supply chain, and that as we would receive allocations of doses, who should we be focused on first? Now, the federal government said healthcare workers and residents that are in nursing homes or long-term care facilities. The community expanded that, which is their sovereign right, and asked us to take our initial allocation and make sure that we included dialysis patients, that we also focused early on elders with significant or serious health concerns, in addition to healthcare and GRIC employees that are frontline, that are working every day with people that are COVID positive, as well as, of course, our caring house staff and residents. So as of this morning, and we have many more scheduled today, we're just about 1,400 vaccines provided. And here's some breakdown of details for you, Roberto, some things that are just right off the printing press. Well, we, on January 6th, had an opportunity to vaccinate our Caring House residents, and in partnership with Walgreens. And it was an excellent session. We had at the time a census of 65 community members in our Caring House and other residents, and 55 of them were eligible to receive the vaccine, because there are some times, perhaps one of them had an illness and had a fever or some other health concern, that they would not be necessarily an immediate candidate. But out of those roughly 55, 46 of the residents were vaccinated. We have our second session coming up here on February 3rd. Also, roughly half the staff there. We are doing roughly half the staff one day, and the next day, the other half, again, to make sure we have staffing. When it comes to our dialysis patients, we had identified roughly 210. 90 immediately consented, of which 70 of those 90 have been vaccinated, and we're finishing that up here in the next few days. And we're continuing to work with the others to, again, inform and educate about the vaccine. When it comes to elders that had serious health concerns, those that the community asked us to focus on first, roughly about 250 of those have been vaccinated so far, and we're averaging about 50 patients now a day at Huhucom that fit into that elder who may have gotten a call because they have a very serious risk because of many pre-existing health conditions. And then in general, we're averaging about 250 to 300 patients a week out of that group to continue to work with. But shortly thereafter, as we started to go through our doses, we've been advocating strongly to receive more doses from IHS, Indian Health Services, which is where we get our vaccine distribution, rather than from the state. And again, direction from community leadership was to now focus as well on what they call phase 1B. So there was phase 1A, phase 1B, not a surprise, there's a phase 1C rollout. Phase 1B includes GRIC essential employees, as well as some essential employees in healthcare, as well as expanding now to all elders in the community. And I know that you may have a sheet there. Perfect. It shows our hotline number. It shows the phase 1A group that were elders that had particular health concerns. And now we've expanded it simply to elders with or without a pre-existing health condition. And to rapidly, since about, and I'm going to give you an exact date here, Roberto, because somebody asked for it, on January 8th, again, we received some direction that the community would like to more rapidly move towards elders in general as defined, and those phase 1B essential employees. So even last week, rapidly, we increased all of our test sites. We had clinics this Saturday and Sunday to include the ability to get the GRIC employees done as quickly as possible that are frontline, that need to be at work, in addition to focusing on our community members. And today, even at D3 at Boys and Girls Club, we've created an additional remote site besides off our own campus to more quickly get through the GRIC employees here over the next 10 days or so. And then we'll ultimately expand and have a couple remote sites in the community besides our on-campus sites. As of this morning, we're actually giving vaccines at 7 sites. Our Caring House for those patients within our dialysis east and west, our primary care at KHC and HHK, our own administration building on Huhucom for through employee health, and now the District 3 Boys and Girls Club. And again, we're focused rapidly on this current group. We received about 3,175 initial doses to cover all of those groups, which is certainly not enough for all elders in the community. As of tomorrow morning, we'll get roughly another 1,000 doses. And then on a weekly basis, as we continue to vaccinate, we'll receive more vaccines. But that is an important point for the listeners on this call. We will be limited in the number of new vaccines we receive every week based on how many we're actually out there giving. It's so important that people realize that when Mr. Pablo from our board said who he was doing it for, that when you're getting a vaccine, you're doing it for yourself if you're eligible at that moment. But by choosing to be vaccinated, you allow us to move forward and get more doses for those that come after you in line based on this priority plan. For example, at some point after we do elders, I'm sure we're going to eventually get to community members in general as these phases roll out. And again, over time, we will certainly get enough vaccines for everybody, but nobody here should be surprised that just like the rest of the country that's waiting for more doses, we certainly are as well. So we listen to our board of directors, our community leadership. We roll it out in a very fair and equitable way, very efficiently, and most importantly, focused on safety. And so I want to make one last comment here, Roberto. When you saw Mr. Pablo's video, you saw that it had various stages, right? There's certainly now for people to call our operators if they're eligible so we can try to get them scheduled right away. Again, especially right now, we're focused on elders. But we also screen people. We really take a long time to review your medical records, to know about your personal medical history, your history of allergies or other things. When you do ultimately come, we take it very serious. We have medical staff and EMS on hand. We observe you afterwards. We're very, very focused on this. We'll never compromise on safety. And even though severe allergic reactions are rare, they need to be recognized promptly and managed. And people absolutely can be safe, but you need that team on hand. And so we screen and we have the teams on site. We observe you for a period of time. And again, we know everyone is anxious to be vaccinated, and we are rolling that out aggressively and constantly trying to pull more doses available for the community, but we're never going to compromise on safety either. So that's where we are, about 1,400. I will tell you that we expect to probably do about 125 to 150 per day when we're dealing with the employees right now through GRIC. That's part of that phase 1B. As I told you, we're really focused as well on elders and finishing up that phase 1A, those seriously at-risk elders that we're personally calling to really educate because they're so vulnerable. So we're reaching out to them personally, but we're inviting all elders to call the hotline to help schedule. And again, as everyone knows, a lot of it's based on how many doses we have. So again, please call early. And if you are told a date that may be a week or 10 days out, please don't be concerned. I see here someone's asking who's in charge of logistics. Well, actually at GRHC, we've had a COVID-19 vaccine task force that has been meeting for months before there were even vaccines that were available. We every year are in the vaccine business, right? So this year we did well over 11,000 influenza vaccines in the community. Every year we're giving pediatric vaccines. We're giving vaccines to elders who get pneumococcal or shingle vaccines. We're a healthcare organization. We truly understand vaccines and vaccine rollout. And so our comprehensive logistics have been coordinated across the governor's task force with the Office of Emergency Management, Tribal Health Department, and especially within GRHC's medical teams. And together, we have a very coordinated plan based on the direction coming from the community leadership of whom to prioritize first. And the logistics are organized in such a fashion. So I saw Roberto, again, that question came up in the chart or in the chat. And again, I want people to know that we're not just reacting to this at the last moment. Months before the federal government even knew it had vaccines to approve, we had our plans in place. We just needed the details and direction from community leadership as to whom to prioritize, as well as to understand how often we'll receive more doses. And we're constantly working on that on a weekly basis with IHS.
Thanks, Doc. Yeah, if you see a question, just start firing away. Let's get into some more of these. Looks like we have one that says, are we currently limited on doses, or is there a reason we are not distributing to our elders daily under extended hours, or if how many doses are being distributed daily in GRIC. And then they also
Sure.
say, Doc, if you're just stay with me here. And it also says at some point, will there be a mass distribution center established in GRIC once we get to the general public? Yeah. So I'll say I'm just your average Joe, Doc. I'm John Q. Public. I don't fall under those initial categories. And I know it's kind of hard to speculate just with all the changes, but maybe you can fill in this gentleman with these questions.
Sure. Well, right now we're already vaccinating formally 6 days a week. And like this past weekend, we added a 7th day on Sunday because DRS needed to quickly have vaccinations for their staff as well because of concerns always in a closed area. We're averaging our vaccines based on exactly what somebody said. Who are the priority groups? And believe it or not, the rate limiting step is not us. We have the capacity across our teams to vaccinate roughly 500 people a day. A lot of it does have to do with people who are eligible not coming forward. I'll be frank about it. Vaccine hesitancy is playing a role. We focus on it in our employees. We focus it in GRIC employees. We focus it like the dialysis patients I just said. I have to tell you that out of the roughly 1,600 elders that were identified in the community with serious health concerns that we're trying to prioritize, again, 244 have been vaccinated, and less than 1 in 4, closer to 1 in 5 who have been eligible that we've spoken with are choosing to come forward. And again, we do focus on that group because they would have the worst possible outcome if they were infected. For elders in general, again, we're not necessarily screening everyone ourselves preferentially. We're waiting for those phone calls to come in, and as we have openings, we put them into it. And as I said, once we get through this phase 1B, where we have these priority groups, again, with limited doses, again, we've received 3,175 doses to date. And we just learned that tomorrow we'll get about 1,000 more doses. But when it comes to opening it up again past these initial priority groups, yes, absolutely. We hope to have a couple other remote sites, perhaps. Again, we won't necessarily do it the same way others are, though, and I'm going to be very clear about this. I know you watch the news, and people may feel like there's a better way to do this, but never forget that we're in the middle of a highly contagious pandemic. Why we're actually getting vaccines. The last thing we want at Gila River Healthcare are for long lines of people sitting next to each other waiting to get vaccinated, and the chance of passing the virus on from one to the other unknowingly, even if you don't have symptoms. Again, 59% of all infections in this country happened when a person did not have symptoms and passed it on to the next person. So we don't want long lines of people sitting next to each other. We also don't want people coming and sitting in a line and finding out that we didn't have any more doses that day. That would upset people horribly. So we are focusing constantly on our logistics of how many doses we have, scheduling people, screening, making sure we have the safety teams out there. We're going to be vaccinating still for many weeks, perhaps to a couple months. And that doesn't even include children, because children aren't even indicated yet for vaccines. So we're going to be in the vaccine business for a while. What we are saying is, when you are eligible, if you're an employee or if you're an elder, please strongly consider being vaccinated. Because again, one of the things that's limiting the numbers we've given are the people willing to come forward and be vaccinated, which is why we are doing this on such a frequent basis out here, to answer your questions, to listen to your concerns, to give the information you need to make what we hope is the decision that we believe is that the vaccine is safe, it's effective, it saves lives, and by you being vaccinated, you allow the next person in the group to potentially get a vaccine, because our distribution is based on how many we vaccinate as well. And that's just the reality of where we are right now with vaccine distribution.
Okay, I like the way you said that, Doc. So we have about 10 minutes and some change left, and just kind of going through the question list. We got 1, 2, 3, 4, 5 questions left, Doc. So that's about maybe about a minute and a half or so for each question. So let's see here if we can just knock these out. Not, obviously getting to the heart of each question with an answer, but let's see how much headway we can make. What do you say?
Let's go for it.
All right. So this one, and I want to thank that previous user for that question. That was very well done. How long will the vaccine last before we have to take it again, or do we not have to take it again?
That's fantastic. Again, as I said, we don't have a definite answer right now from the current clinical trials. They've just reported 120 days out, or 4 months, that those antibody levels are very high and they're strong quality antibodies. They're going to follow that out for 2 years. But what I can say from other people in similar research, there's a real belief and hopeful that the vaccines will last at least a year. I need everyone to know that we're going to be dealing with this virus for a long time. We're certainly in this country, that term herd immunity, when enough of us have a level of protection that we can start thinking about again being able to be in public together, and whether it's at concerts or whether it's in school systems or businesses being open, we're quite a ways away. We probably are still going to see ourselves in this posture at least through the end of late summer, maybe into early autumn. But that doesn't mean that the virus has gone away, just like the flu virus doesn't go away. And it's reached all over the world. And we have to acknowledge that there are going to be places in the world that do not have access to the vaccines that we do, and how aggressive we're going to be about trying to get them out. So we're going to be dealing with this. And as we know, people internationally travel. This virus is going to be with us a long time. And the question is, how long does this vaccine last? And then when will we potentially need to be vaccinated again? That is still to be answered. But I will tell you that very much like the influenza vaccine, I think most people believe that this vaccine that we're receiving right now will not be a vaccine that lasts for a person's lifetime. I think most of us believe it'll be very much like a flu vaccine, but the exact number of days, whether it's a 6 month, whether it's a year, whether it's 2 years, I just can't answer that yet because the science hasn't answered it. But there's some hopeful signs that it'll be at least a year.
Okay. And if someone shows no symptoms but has the virus and receives the vaccine, what is the outcome / result for the person getting the vaccine? Is the vaccine going to be effective? And it's no coincidence, doctor. We're seeing a lot of questions about relating to those who have had the virus. I guess that goes to show that, there's, as you said, the virus is still very much with us, and we're starting to see people who have had COVID-19, they're still curious. So if someone shows no symptoms but has the virus and receives the vaccine, what is the outcome for the person getting the vaccine? Is the vaccine going to be effective? Dr. Santiago, what say you?
Excellent. It's a great question. So here's 2 or 3 facts that you can take away from that question. First, if a person actively had COVID and received the vaccine, they're not going to be harmed by the vaccine. And it doesn't mean that the vaccine might not be effective long term, even though they'll have to finish the 2-dose protocol. But it doesn't mean that it's going to help shorten their current illness. And that's an important fact because it takes a while. After you receive the first dose, if you take the Pfizer vaccine, 21 days later, you get your second dose. And a week after that, we start to see that significant number in your antibodies. If it's the Moderna vaccine, you take the first dose, 28 days later, you get your second dose, and about 10 days to 2 weeks after that, you start to have that rise in antibodies. So we're talking 4 to 6 weeks before those antibodies are really in your system and effective. So if you're currently infected, it most likely isn't going to shorten your current illness, but in no way harmed. And in no way does it mean that you won't get the protection if you finish the 2-dose protocol. The reason we typically limit people who are actively infected from getting the vaccine right now is because we simply don't want you out of quarantine walking around and potentially infecting others. It has nothing to do with the vaccine as much as the fact that you're a risk to transmit to others. So we recommend that people finish their 14-day quarantine. And if they have no symptoms, then they could be scheduled to receive the vaccine.
Okay.
And facts, because I see the question there. Can a flu shot and COVID vaccine be taken together? Yes, it's not a problem. It doesn't mean that they're not going to work well or one's going to make the other one less effective. Sometimes we try not to give people multiple vaccines because, again, it can hurt your arms or again, potential side effects. But that's the only thing that limits it. There are certain vaccines for sure, like the tetanus vaccine and the COVID, we probably wouldn't give together, especially because of, again, the sore arm.
No, I
And
don't
then lastly, no, most people don't want it. And then, Roberto, that one last question the person asked, what if I've had COVID-19? Well, remember, not everyone has the same course of COVID-19. You may be a person who is actually in the hospital and received something called monoclonal antibodies, a very sophisticated drug to treat it. We actually do that here at Gila River Healthcare. We have the same sophisticated treatments that you would have at any hospital system. And if you were one of those rare people who did receive that, then we actually have you wait 90 days till you get your vaccine. But again, that's why we talk to people, we screen them so we know each individual person. So there's a lot of details. Some of them will get across on the call. Others won't happen until you're talking to somebody personally at healthcare when you call to schedule.
Okay, while we get the next question queued up, Doc, can you repeat for this one individual who's curious about the waiting time? How long after the virus can you be administered the vaccine? I remember you mentioned something about a quarantine, so 14 days later, then you can get it?
Yeah, if you're told that you have COVID-19, you've tested positive, or you've had a high risk exposure and you weren't tested and you were asked to quarantine, as long as you don't develop any symptoms, at day 14, your quarantine is over, you could have a vaccine on day 15. If you're a person during those 14 days, let's say on day 8 or 9, you start to get a fever and chills and a cough and you're sick for a few days, what we would say is even though your day 14 quarantine might have passed, we still wait till you're without symptoms like a fever or chills or signs of active infection for at least 4 days before we would schedule you. So again, fairly shortly thereafter, just 4 days after you've recovered from your symptoms and you've been on quarantine, or maybe just the quarantine period itself because you never developed symptoms. But the purpose is to make sure you're safe to be around other people, of course, still wearing a mask. It's not about you being harmed by the vaccine or missing a chance to treat your illness. It's just that we don't want people that are actively infected out in the public.
Everybody's different, and I think that's kind of what we're learning. How you said, not everyone gets the same course of COVID. So we're gonna help out this individual who wants to know if they are eligible. So it says that they have a pre-existing illness, and is it recommended to get the COVID-19 vaccine? So let's have this number ready for them. 520-550-6079. So Doc, with this individual's questions, they call that number, then what happens?
Sure. So there'll be an operator on the call. And by Wednesday this week, because of the sheer volume of calls and how we're, again, utilizing our staff, that's going to be staffed by even 4 ends separately, just to constantly take all the incoming calls. Like I said, in the last week, nearly 2,800 calls came into our system. You're going to call, you're going to identify yourself. They're going to go over where we are in that priority. Right now, they're going to ask you first and foremost, are you an elder 55 or older? Or are you perhaps an employee that from GRIC and maybe you missed an opportunity or didn't hear it through your own department and you have a question? But most likely it's going to be our patients that are elders. Perhaps you're going to tell us that you're 35, but you have a serious health concern. Again, the team's going to talk to you, listen. At this point, we're focused on elders with serious health conditions and elders in general. People certainly wish to get to anyone who has a serious health concern, and all of us in general. At this moment, based on the number of doses we have and direction from the community leadership, we're focused currently, again, on elders with serious health concerns initially in phase 1A, all elders in phase 1B. We've also prioritized dialysis patients and our caring house residents. And if you fall outside one of those groups, people will still talk, they'll listen to you. But for that general person like you, Roberto, young, handsome guy, no real serious health concerns, waiting for when it's going to be your turn, really, we're going to have to wait until we see what happens. And I think with the Biden administration, how more rapidly they're going to get doses out to all of us, whether it's the state or IHS to distribute. But I have to tell you, our team is ready. Each time we get an allocation of vaccine doses, especially if we are able to get more doses in a rapid fashion, as well as direction from community leadership, who next to prioritize, our team is ready to roll them out as quickly as possible.
Okay, thanks, Doc. And you very accurately described what kind of caller I would be when I get around to calling. And so it looks like we have our final question, Doc. We want to thank everyone for staying on line with us. Looks like we're at about 30 participants, which is, I think we've hovered around the 30 mark as far as Zoom goes. I don't have the numbers for Facebook, but they're probably off the charts. And same thing, all of our viewers on channels 19.1, 29.1. So we don't have like any kind of like sound or bell or something when we get to the last question. But I think a real show of gratitude is in order for all of our people that have chatted with us, that have commented with us. And this is really what it's all about. So establishing this communication via Zoom, via Facebook, whatever, I think it's important for this vaccine, for our testing here in the Gila River Indian community, especially when you have someone like the CEO of Gila River Healthcare, who's been such a willing and, participant, open with a schedule. So I think that goes to show the kind of people that we have at the very top when it comes to running logistics or, making a lot of these informed decisions. So Doc, it's the last question. Here we go. It says, if you take the vaccine and get symptoms the same as COVID-19, will you be a confirmed COVID-19 case with new strains of COVID happening? Will we need an additional vaccine for those as well? Or does this vaccine cover all the strains? Doc, what do you got?
First of all, great question. And there's two questions in there. So I'm going to take the strain first, and then just what happens if you actually contracted COVID-19 despite being vaccinated. So with the strains right now, and people are following this very closely, there are really 4 main strains that have come out since the dominant strain that we're all aware of. First of all, everybody should know that viruses mutate all the time. There have been thousands of mutations in this virus. And the UK especially has been sequencing all of these strains. The US is finally just starting to come up to speed. And when you have a particular version of the virus that seems to be in most people, that's what we used for creating the current vaccines that are out there. Since then, there's one in the UK. And again, I apologize for labeling it after a country, but I think it's how they do it in the press. So it's how you'll all recall it from your own reading or viewing. In southern UK recently. There's also one in South Africa, one in Brazil, and one in Nigeria. And now there's concerns about potential even variants here. First of all, we should all expect that there will be mutations. It happens in all viruses, and it often happens in one of 2 ways. Naturally, there can be spontaneous mutations that either are unfortunately helpful to the virus, and then they continue to be passed on, or perhaps they're not, and they don't make a difference. But it can also happen when a person perhaps who's got an immune deficiency themselves and they're infected, the virus can act like a superbug inside of them and really create a lot of mutations. And that's probably what happened in the UK, what's happening elsewhere. What we know from a couple of these new strains is that they are more contagious. They're more able to transmit from one person to the other. We haven't seen a change in them that makes them more deadly once the person contracts it, but it does mean it's easier to transmit it, about 70% or so. And that's very concerning. In one of the strains, it's been shown that some of the treatments we have, these monoclonal antibodies I talked about, companies like Regeneron and these long medication names that some of you may know, that it may be mildly resistant against them. So these are very concerning issues. Right now, Pfizer and Moderna are testing their vaccine against those strains. The way Pfizer did it recently was to take so many people who had received their vaccine that have antibodies in their blood, and then they took those antibodies in a person and exposed them in various lab dishes to these various strains, showing that it was still effective. The fact is that the spike protein, that piece of the protein on that protrusion, that stick that comes out of the virus, when you see it in pictures, that is what they call conserved. It means that all the strains essentially really do conserve the way that spike protein looks and what it's made of. There have been some recent modifications, but so far, the vaccines to date in the data reported appears to be effective. I can tell you that the companies are working strongly to constantly test against it, and I'm sure there'll be modifications if it's necessary, but it points out that this is far from over, that you must absolutely be vaccinated because it is by far your best protection right now, considering that there are strains out there that are even more transmissible. And I know, Roberto, we're at the top of the hour, but I want to take an extra 30 seconds and say this. Right now in this country, the number of influenza cases is the least it's been in nearly a decade. Because of physical distancing and mask wearing, we have some of the lowest influenza cases ever, 95% less than last year, 90% compared to the last 5 years. That tells us that wearing a mask and physically distancing helps prevent the spread of a virus. And yet we're dealing with the highest surge right now of COVID-19. That doesn't mean that masks and other things don't work. They do, dramatically so. That tells you how dangerous the existing strain is. So any other strain that could be more transmissible is a concern. Getting people to be vaccinated and complete the vaccine series, both doses, is our greatest defense against the strain, and preventing people from perhaps taking one dose, not coming back, and being a person who could potentially be someone who contracts COVID-19 and then creates a version of it that's learned to elude the vaccine because it wasn't finished. We've all heard of this with antibiotics, when people don't finish their doses as they're prescribed, and then, quote, superbugs develop. This is a frightful time, and you should be, but that doesn't mean be frightful of the vaccine, but be frightful of the virus. And then lastly, the question about what happens if you contract COVID-19. Well, first of all, remember that in the clinical trials, they were not 100%. A good flu vaccine is about 40 to 50% protective. These have been 95% in the clinical trial, which is outstanding, but that's not 100%. We're all a little bit different, our own immune systems. Number two, imagine that you get vaccinated on a Monday and then like today, and on Wednesday you develop COVID-19 symptoms and are testing positive. You did not get it from the vaccine. What happens with the COVID virus is this. There's an incubation period in the body. The average person who's exposed doesn't develop symptoms until day 5 to 6 after being exposed. It's in their body starting to divide, and it's starting its unfortunate attack on the body without defenses. By the time roughly 90% of people develop their symptoms, it's 5 or 6 days later. When you get a single dose of the vaccine, as I said, even though there's some promising research, the reality is we cannot say that you're protected from COVID-19 at that serious 95% level till you have finished both doses, and it's at least a week or so later. So the fact is, you can get your vaccine and still be out there and be exposed and contract it naturally. You must continue to protect yourself by wearing masks and distancing and washing your hands. And then afterwards, after you finish both doses and you yourself have heightened protection, you need to protect yourself from the virus so that you lessen your chances even more so, and to make sure you're not the person who passes it on to somebody else, causing them to get sick as well. And Roberto, my final comment is this. These are effective and safe vaccines. Do we know everything about them, such as, are they going to cover all strains? No. Do we know how long the protection's going to last yet? No. But they are effective, they are safe, and I certainly took it. My family is taking it. My elderly parents back in New York, because they qualify. When it's her turn, my wife will, my own family will, our employees at GRHC. If we in the medical community did not have faith in this, we would not be taking it ourselves. We would not be giving it to our families. We would not be giving it to our patients. I understand that we don't know everything we wish we knew, but we do know this. In 385 days, this virus, at this point right now, in real time, just so everyone's aware, 95,415,000 people documented, we believe the number's higher, over 2 million deaths. And in this country right now, this moment, 24 million cases and approaching 400,000 people killed. That I know, and that's a real fact. The vaccines are safe, they're effective. Please get it for yourself, get it for your family, get it for the rest of the community, because the more people, when they're eligible, that receive a vaccine, the more doses we will receive more quickly. You're helping the next person in line by getting it when it's your turn.
Well, Doc, you are in rare form today, and unfortunately, we're going to have to end it on that note. So, Dr. Anthony Santiago was, just elaborating to, a very high degree on these questions. We didn't have the amount of questions as we did the last couple of times, but I think this allowed us to go more in depth and just explore these from all different angles. So we want to thank everyone for providing those questions and really getting us started on the right foot. And if you're just joining us, well, you're going to have to catch the replay because we are going to shut it down for now. We want to thank Gila River Broadcasting Corporation, Gila River Healthcare, the task force started by Governor Lewis back in January, and then also all the members of the team, all the tribal leadership, Health and Social Standing Committee, Gila River Healthcare's board, and for Dr. Santiago as well. My name is Roberto. This has been another forum, and we'll catch you guys next time. Everyone be safe, wear your mask, social distance, and we'll see you next time.
Roberto, right?